when we look at Obamacare, one of the things that we're trying to make sure that people understand, I've talked to several senior citizens lately, and what they have told me is when it comes to Obamacare, they're not affected. And what I like to say is I think, this is sort of insidious, and I don't think that people understand how they're being affected. So, first of all, $500 billion was taken out of Medicare through Obamacare and sent to Medicaid at a time when 10,000 new Medicare recipients are being added every day. So there's less money for the program, and the program has a $43 trillion unfunded liability. It's not sustainable. The trustees came out with a report that said, I think the year was 2030. They said it would be, it would work. It would be sustainable until 2030. But someone has pointed out that is on the basis of a GDP that is at 3.2%.
Right.
When it's only been at 1.2% recently.
Right.
So the likelihood is that Medicare is going to be broke much sooner than 2030. And the other thing that I like to point out is the fact of what both Republicans and Democrats are doing when it comes to paying the doctors of people on Medicare. And so there are things that are new payment systems that are essentially lump sum. So just think of your doctor or your hospital getting a lump sum payment. These kind of payments are either for a procedure, and often that's called a bundled payment, so they get, no matter what happens for that procedure, you go in and you have your hip replaced, then the doctor or the hospital will get a lump sum payment, no matter what your complications are, no matter what kind of hip joint was used, and they have to try and reap a profit, a savings out of that money in order to pay for all their expenses. The other thing that Obama does is move towards something called accountable care organizations, where the hospital joins with a bunch of clinics, and they get a lump sum payment, either for the year, or some say the federal government wants to do it for 3 years. If the hospital gets a lump sum payment to take care of their entire population, and these hospitals are saying, we don't know who our population is, but they get one payment at the beginning of the year, and they have to divvy it out through the year. Then you can see how the patient becomes essentially a financial
liability.
burden.
Liability. Yeah,
That's right.
absolutely. Yeah.
An adversary to the doctor.
Sure.
You might not get the kind of hip joint that you want because they're going to try to they're going to evaluate, well, how long do you think that person's going to live and need this hip? So maybe we should give them a hip that will only last for 10 years rather than the hip that will last for 20, because that would be less expensive. And we only have this limited set of money. So that's where everything is being driven in Medicare and Obamacare. And it's not just the Democrats, because that's part of what the Republicans did with their Doc Fix bill in April, is they gave 2 new ways to pay doctors. And one is on quality basis with a whole bunch of data reporting, but the other one is on alternative payments. And those are all lump sum payments. So that is where the entire thing is being driven. And if you're someone depending on the doctor or the hospital to give you the care that you need, and you realize that the doctor and the hospital are not going to be paid for the care that you actually receive, they're just going to be paid a certain amount out of which they have to take money, you can see that there might be a danger there for patients.
Yeah, well, they're incentivizing hospitals and doctors, obviously, to, cut care and eliminate certain things. And, I was hit with a piece of stark reality yesterday. My wife went to a doctor, went to a specialist, and she said, she was telling me that when she came back that, she was talking to him, and they said, what kind of insurance you have? And she said, well, we're with a health sharing ministry. And so they said, well, what is that? And she said, well, basically we're private pay for now. We're considered private pay. And she shared with them Samaritan Ministries and what they're all about. Anyway, they reduced her bill by 40%.
Yeah. 40%.
And when you think about that from a government standpoint, I don't, it just struck me as this is why we need some good, strong private sector, free market economy kinds of fixes to this, and to maintain some quality of health care. And it was very interesting because they said, well, they still weren't fully sure what this was all about. And they said, well, you probably should go do such and such. But maybe since you're, private pay, you don't want to do that. She said, no, that's fine. That would be fine. We'll do that. And so they were hesitant to even tell her that she needs to have a certain, ought to do something that might be beneficial, obviously to diagnosis or to help her. So, I find it more and more interesting as I think about, where we're headed and this socialized medicine. 3 times I've been in emergency rooms in Europe, and I've always tell people, if you think you want socialized medicine, you really need to visit an emergency room anywhere in Europe. Just stick your head in the door and see what it's like, because it is incredible. It's like nothing you can imagine, and you kind of get a picture of what healthcare is like over there. So interesting.
I would love to hear people's stories about what they think healthcare is like here today. Of those who have been using healthcare services over time and have seen changes. I just heard from a guy that had a surgery, and he told me, he said, I wish that I would have researched it better. I wish that I would have known the questions to ask so that I could understand what was going to happen after the surgery was done. And I just looked at him and I said, that's actually not your responsibility. A patient is not a customer. A patient is a vulnerable person. Someone who doesn't have all the expertise of the doctor, doesn't have all the expertise of the nurse, has a different expertise in their life, whatever that is, right? Whatever their job is.
Right.
But when they come into the hospital, into the clinic setting, they are vulnerable. And it is the responsibility of the doctors and the nurses to spend enough time with them to tell them everything that they need to know to make an informed decision before they consent. And I said, how long did the doctor spend with you? And he said, as little time as he could. He got out of there as quick as he could.
Right.
And so this is where I say that the mission of medicine is being moved to the business of healthcare. And this is not caring or considerate to patients, and it's not understanding their vulnerability. We are not cogs on a conveyor belt going through this system. We're actually individuals in need of care and understanding and information to make informed decisions about what we want for the quality and length of our life. And so there is a button. There's several buttons on our website, either the Obamacare button or there's just the feedback button at the radio section for our Health Freedom Minute. And I'd love to hear what people think when they go into the doctor's office today and how they feel that they're treated compared to other times, and whether or not that's, are you going in with cash? Are you going in with coverage? I would just love to hear the stories, because I think those stories will share what's happening to our healthcare system for good or not.
You can go to cchfreedom.org, folks, to check that out and put your story in there. That would be great. cchfreedom.org. Sign up to get subscribe to receive that health freedom information that Twyla sends out every week. Twyla, what are some of the action things aside from motivating? We need to continue to motivate everybody to call, sign petitions to defund Planned Parenthood. But what are some of the action things that are in the forefront of legislators' agenda that we need to be calling about?
So I think one of the big things at the congressional level is the 21st Century Cures Act. And this has been called, on the House side, a bipartisan love fest. But it shouldn't be, because what it does is it says that all of our health information is open to being used for research without our consent. It makes health data research, so all the data in your medical records, available for research, calling it purely a healthcare operation, and therefore your consent is not needed. That's a change in a change in current law, and the whole idea there is to get access to everyone's medical records to come up with new cures. But that's, sort of the selling feature of it. But what it does is it violates the patient-doctor relationship. It violates your privacy. It says that your data is no longer your data, but essentially public data, public information for all sorts of other people to use, to analyze you, to profile you, to put your information together to come out with treatment protocols which may actually harm you. Because they'll say, well, so this many people did X, Y, Z, and so now this is the only kind of treatment we're going to use. So the Senate right now, the House has passed the bill, and the Senate is working on their own version of the 21st Century Cures Act. We have been talking to certain members of the Senate, and we have been trying to figure out exactly what they're doing, but we don't know, and it hasn't come out. But I think the really important thing is just to call your senators and say, do not let anyone have access to my medical records without my consent. The House is doing that. You in the Senate, don't do that. Don't let that become law.
Well, that's great. And that's what we need to do. We need to constantly be reminding our listeners that, we've got to call. I call at least 3 times a week about something, or email or even fax. I don't have everyone's fax number, but I have a lot of them. And we need to be calling our senators. And folks, don't forget, you call their local office too. Call their national office, that's fine, but call the local office to your specific senator, and say the same thing. Do not let your health records be public information.